Good evening. My name is Karen, and I'm a Community Education Coordinator for Boulder Community Health. I'd like to welcome you to our lecture on best ways to handle sports concussions. I'd like to go over the format for the lecture. The lecture portion will last about 45 minutes. Afterwards, we'll use the remaining time for questions. Please type your short general question in the chat box below the video on your screen, and we will take as many as we can. On behalf of Boulder Community Health, it's my pleasure to introduce this evening's speaker, Dr. Sherrie Ballantine-Talmadge. Dr. Ballantine-Talmadge, or Dr. B as she's known, is board certified in both family medicine and sports medicine. She enjoys utilizing her broad spectrum of training to care for active individuals and athletes as a primary care sports medicine physician. She completed her sports medicine fellowship in Toledo, Ohio. Her unique combination of osteopathic and sports training allows her to approach patients in a comprehensive manner, from the recreational to the Olympic level athlete. She has worked at 3 Division I universities, served as team physician at Northwestern University, and travels as a team physician with U.S. figure skating. She has also provided coverage at the Chicago Marathon and at the Kona Ironman Triathlon. Dr. Ballantine-Talmadge sees patients at CU Sports Medicine and Performance Center in Boulder. Welcome, Dr. B.
Thanks so much. Well, we're back. Thanks so much for being here tonight. I just have to start off by really thanking Boulder Community Health and Hospital for this opportunity and their commitment to helping us get back to school so nicely. We've been doing this lecture at this time of year for a couple years now, so I hope we have people that it's your first time tuning in. I hope that there maybe is repeat people coming so you can hear the latest updates. So yes, tonight we're going to talk about concussion. School's been in session just for a couple of weeks. Sports has been going for a couple weeks too, and we already have our first concussions of the season. So let's talk about concussion. I do put some jokes up here because what happened, right? Like many of us are from the era where it was just a ding and it wasn't a big deal, right? The 80s and the 90s, and then something got really crazy and you would read in New York Times articles and all these things. Should you even be letting your kids play sports? Should they be playing football? Should they be playing soccer, rugby, ice hockey? So what happened? I always tell people I wish that something else would take over the headlines and then I didn't necessarily need a worldwide pandemic like COVID, but either way, we still have always heard about things in concussion. So what happened? So what happened is, I remember when I was in medical school thinking to myself, who on earth would want to do this? Because there were so many different grading scales, and how do you know which grading scale to use? Well, all of that stopped for us in sports medicine, and as you can see here in 2001, and everyone got together first in Vienna, and we had the first international consensus on sport-related concussion. And then there was this thing that was called COVID, because you can see how frequent these international symposiums came that created this consensus statement. COVID kind of delayed us a little bit, but then we finally got the 6th, and that is the most recent international consensus guideline on sport-related concussion. And so this is really important for you to know if you're wondering where all of this lecture is coming from and kind of what our guidelines are for how we talk about sport-related concussion. It's really from that. And there's a lot of things in this presentation where I won't go through every little aspect of the slide, but they're really for you to be references if you're coaches, trainers, parents, kids, whatever focus that you're looking at this lecture from, I want you to have it. So in the bottom left here, you can see the reference for that international consensus statement. And this year, this past consensus statement, they divided everything into 11 R's of sport-related concussion. It is important for us to make sure that we understand that we are talking about sport-related concussion. There are different kinds of concussions that happen. So although some of the concepts here are pretty similar, it's going to be a lot different if you're talking about military blast concussions or motor vehicle accident concussions. they are different, and it is important for you to know that. How we treat them have some similarities, but those kinds of concussions can have much more complicated things, and they can definitely take longer. This is a really busy slide, but this comes straight from the International Consensus Statement. So how do we define concussion? That's really important, and this comes straight out of it because there's so much about not really knowing how to describe it. So how we define it is traumatic brain injury, which it is, caused by a direct blow to the head, neck, or body, resulting in an impulsive force being transmitted to the brain that occurs in sports and exercise-related activity. So in no way, shape, or form here do you hear about bruising or a brain bleed or a skull fracture, a bruise a lot of times. So that's how we define it. And it does have a separate definition as opposed to the other more significant types of brain injury like subarachnoid hemorrhage and things like that. As you go through this, you can see that then after that damage happens, it causes neurotransmitter and a metabolic cascade where you have injury to the cell death. The injury is to the axon, which is your nerve cell, and then blood flow changes for sure, and then all kinds of inflammatory changes and products that affect how your brain functions. And concussion is a functional diagnosis. It's a functional injury. That is not structural. That's very intentional because you can't see it, right? You can't see it on an MRI, which we're going to talk about shortly. So it causes a dysfunction, and that's really important to understand. And it may or may not involve loss of consciousness, which is also really important. As she mentioned, I've worked on a lot of college campuses and work with a lot of students. And you also have to understand that concussion, also you have to be careful because a lot of times some of the similar symptoms can be explained by alcohol or drug use or something that is maybe affecting someone's appearance that could look very similar with concussion. So this most recent one was held in Amsterdam, and even though they made all of the kind of changes they did and updated, and they look at all of the research that is out there internationally, we still have to remember we have a saying in concussion that once you've seen one concussion, you've seen one concussion. So this statement is still very true. With all the changes that are made in these updates, we still have to remember that the assessment, treatment, and management and advice for each concussion is different. So you could be the same person, get 2 concussions, and what we tell you on one concussion may look different than on the second one. So that's important. So hopefully when I lecture, whatever group I'm lecturing to, I always say, hopefully I will do a good job and you'll take away one thing that you've learned. This bell-shaped curve talks about the truth. Where do we find it? Is it in the New York Times? Is it in the Denver Post? Is it in a blog? Is it on Facebook? I don't know, whatever social media thing you use. We need to find the truth, and the truth is in short supply when you read about most things with concussion. So let's go through this. I do this with almost every concussion lecture I do. Let's talk about myths, right? So you have to hit your head. True or false? If you were here in the audience, I'd raise your hand. Do you have to hit your head? No, you don't have to hit your head. You can have a whiplash mechanism because your brain is floating in water and it's going, or in cerebral spinal fluid, it's going to hit the inside part of your brain, so of your skull. So that's how it happens. Whiplash can do it, and every year we'll have one kid that even will land so hard on their bottom that it'll even translate up and create that kind of force where they can even get a whiplash kind of injury from hitting their bottom that creates a concussion. So we have to watch this, and a lot of times when we look at video and playback and you're trying to figure out what happened to this kid, you can see them getting jostled around. What about this one? This is really important because this, I think this helps our ER and our urgent care healthcare providers. You need a CT scan or an MRI to diagnose a concussion. And the answer is no. And it's really important to know that because when you take your kid or you go to the ER or the urgent care, this idea that you have to leave there with imaging isn't always the case. And they have done a lot of research to make sure that when they're giving a CT scan, which has radiation, when it is appropriate and not. So if they're doing a CT scan on you, they're looking for something that's really bad, like a brain bleed or a skull fracture, but not to see a concussion. It's a functional disturbance, right? Oh man, if you lose consciousness, you're in big trouble. Well, is that true or false? Well, initially in 2001, we had defined sport-related concussion simple or complex, complex being whether or not you lost consciousness or not. Then we got rid of it because actually the majority of concussions that are happening, you don't lose consciousness, and loss of consciousness does not dictate severity of concussion. So I have a ton of kids and people who have no loss of consciousness that will have concussions that will last for a really long time, and people who will lose consciousness, even with the facial fracture, will be back playing sooner. So loss of consciousness is not as much of a concern in the world of concussion. Helmets and soccer bands prevent concussion. So this can be controversial depending on who you're talking to, but the reality is they don't. It's not going to protect because it's not going to prevent either. Because if that was true, football, ice hockey would not get concussions, and they certainly do. Years ago, the soccer bans came out and there were people that swore that it protected you. Here's what we know. You're wearing a mouth guard, you're wearing helmets because you don't have more serious injuries that could kill you, like a skull fracture or a brain bleed. This is Boulder, so we bike all over the place. You're wearing that helmet to save your life, okay? So you can get a bad concussion, that's okay, we can get you better. But if you have a brain bleed or a skull fracture, we may lose you. So it's still important to wear your helmets, but they're not gonna necessarily protect you from the concussion. All right, this one is a big one, really, really big one. I don't know why this happens. So once your headache is gone, you can play again. True or false? Well, that's false because this is spinning for a reason. What if the main symptom that you have from your concussion is vertigo or dizziness and you don't have headache? I don't know where this comes from, but we still see this for years that people are told, yeah, once you are symptom free and you don't have a headache anymore, next thing you know, you can go back, and that's not the case. So you have to be mindful that all those symptoms are better. This one, there's nothing you can do for a concussion. That is absolutely not true. There is so much that we can do, and hopefully you'll learn a little bit about that tonight. We get calls from athletes and patients all over the country. It's no slight on other places in the country. We're very fortunate in our town to be very active and have a sports medicine center like we do, but there's so much that you can do for concussion. Gone are the days where you just sit in a dark room and do nothing. And so our athletes and people will call, they're saying there's nothing for me to do, what should I do? So this is an active approach to concussion management, which is great because when you get this diagnosis, it can make you feel really sad. So knowing that there's something you can do about it can restore your hope and make you feel like, okay, I can come back. This one, also very controversial statement, concussion causes CTE. So CTE, for any of you that have watched or have heard about the movie Concussion with Will Smith, you know, all the things that are out there, people come to the office and ask, are my repetitive hits gonna cause me to have Alzheimer's and things like that? That's a different conversation than CTE. CTE is a diagnosis that you can only make post-mortem, so after you die, after you look at the brain slides. But there is not one piece of evidence that directly links concussion to the development of CTE. It's not causal. Could it be correlation? That's a little bit different, but causing is a completely different topic of conversation. So this is important to know. So a couple graphics in here, like I kind of alluded to earlier. This is the most common head injury in sports. We see it all the time, right? That's why I'm a sports medicine physician talking about it. Again, it's shearing forces. Your brain, as you can see in that picture, it's being bathed and nourished by the cerebral spinal fluid, and there's inertial forces that happen. I wish it was as simple as this diagram that you see here, that I've hit my head right in the front and I'm gonna get my concussion in the frontal area. I'm gonna know that frontal things are gonna go down. That's not the case because there's so many different forces that happen. You could hit here. You could have something called a contracute injury where it comes into the occiput. So it changing the way that the brain is working. It's functional and it's different for every person. So we have football that's already started. We could have two kids on the sideline, one kid that just keeps repeating himself over and over again, and another kid who wants to go to sleep and is nauseous and vomiting, right? So they can look completely different. It can occur in any type of sporting activity, practice, or competition. And it can be super mild and get better in a couple days, or it can take weeks, months, years. So I have a lot of different diagrams here. It depends if you're a verbal learner or if you're a visual learner. So I like to put different ones in for you. This is the host of symptoms that concussion can do. And I just want to remind you that concussion is what we say in medicine. It's a syndrome. Syndromes are tough because a brain bleed's relatively straightforward. You do a CT scan, later an MRI, you can see that brain bleed. And you can have an objective piece of information. Sepsis, you can see person has elevated white blood cell count and their blood pressure's tanking. You can see numbers and evidence. Concussion, you see symptoms, which is so difficult because it's a constellation of symptoms. That's how a syndrome is defined, by a cluster of symptoms. So what you see here is this, it can be somatic symptoms, cognitive symptoms, emotional symptoms, all kinds of different symptoms. So it can be really vague. One of my all-time favorite kids, on the day I cleared her to return to soccer, she marked a 5 on her grading scale for irritability. And I said, honey, what's this all about? Like, you have no symptoms but this. And she said, I have a younger sister. I'm always irritable. So you have to remember that, you have to look into these symptoms and understand why they're there. This is a visual for you of all the different things that you could look like. Symptoms of a concussion: you could look really dizzy, you could have difficulty concentrating, you can have vomiting. So this can look really diverse. So, the more you see, the more you understand. Sometimes I don't even know, and I can't even imagine how many thousands of concussions I've seen in my career. It can be really variable. This picture is probably one of my favorite pictures whenever I talk about concussion. You say it's really not that hard, right? And if you look at this, it's like, oh yeah, it's vestibular, it's headache, it's autonomic, it's ocular. It's all of those things. And so I think that's maybe one of the reasons why I personally like it so much. My students talk about how we figure out puzzles in the office. It is a puzzle, but it's a diagnosis in sports medicine, one of the very, very, very few where you do get to use your whole brain and you have to think about every system all at one time. So this is another busy slide, but I wanted you to have this information. There's some really encouraging data coming out of this new international consensus statement that talks about ways we can actually prevent concussion outside of wearing helmets. So we talk about specifically ways that we practice in certain sports. So getting rid of checking in certain ages of ice hockey, right? How many times are you going to do full pads and helmets? How many times are you going to have actually tackling happening in practices? Those kinds of things have some research behind them now, which is really exciting. One on here that's pretty cool is the mouth guard study that they did. Using mouth guards, 28% reduced concussion rate in ice hockey across all age groups. So use your mouth guard. That's really awesome. My favorite one here that is really cool that I'll circle back to at the end. This was published and was looking at rugby. And this is participation of on the field neuromuscular training could potentially decrease the rate of concussion. What that is like learning how your body moves. So understanding how my body moves, how can I get away from someone to maybe not see that person that's going to come and tackle me or not see that goalpost or something I could run into. So this is incredibly promising because we know how to do neuromuscular testing in sports medicine. So we'll come back to this at the end. So what do you do if you're a parent and it's like on my way here, I passed by my local elementary school and they're playing like little peewee football, right? What do they do? I'm not standing there. There's no athletic trainer there. We have club sports happening all over Boulder County and all over the state. There's not always a team physician or an athletic trainer, right? So what do you do if you suspect that there's a concussion? You remove that athlete. That's the number one most important thing that you can do. If they're not acting right, you're going to pull them out. You want to ask them specific questions about what they're doing. If they're playing football and they start talking about basketball, you got a problem. You want to ask them about specific things like what quarter are we in? Who are we playing? What field are we on? Those kinds of things are really important. One really good thing that has changed over the last 20 years now is you do as coaches and even as parents have a higher responsibility to take care of these athletes. And don't just say it's a ding. If you're not sure, you pull that athlete, you pull that patient because the danger of letting them go back out is pretty significant. And then you get them to a medical provider as soon as possible. We know from the evidence that the sooner we see a concussion, the faster that concussion is going to get better, which is super cool. So get them out. What else do you do? So this came out years ago when the CDC really did their Heads Up campaign. This is great. Just if you get like one thing from tonight, just like one thing, when in doubt, send them out. When in doubt, send them out. That's straight from the CDC. It's lovely. It makes sense. We have state laws in every state in this country to support you. This can be a tough decision. Final playoffs, you name it, like last game of your senior year, you get one brain. We can put multiple knees in. I hate to say that, but we can. We don't get to replace your brain. You get one. So when in doubt, send them out. So things that you would take them out for if you're not sure is immediate removal if you suspect that they've had loss of consciousness. If they've had loss of consciousness, pull them out and assess. They might be fine, but you don't know. Tonic posturing or seizure. They can't walk a straight line. They have poor balance. There's some confusion. You tell them to run this play, they run that way. So as coaches and even as teammates, you can say, hey, coach, this guy's not acting right. This young lady's not acting right. And pull them so that they can at least have a question, fast to them. And then remember, they can't return that same day. The only way that if we're suspicious, if you're watching us on the sideline, that athlete or person can go back to play is if they're seen by someone that has our kind of training, and we can run them through things. But there's absolutely no, and there should not be any expectation that you as a parent or you as a referee is a big one, or you as a coach should feel the responsibility to try to get that kid back out. Your job right there is to protect them if you don't have a healthcare professional with you. The Maddox questions are those questions I was just alluding to. Don't ask them who the president is. Don't ask them what month it is. Ask them who they're playing. This is happening in a sports related context. So ask them sport specific things. And that's been proven in the literature over and over again. I really want you to have this. This also, it gets updated. You can see it's the number 6 version because it matches. So that concussion statement creates all these different kind of documents that you're going to see tonight. This is one you should have. You can put it onto your phone. It's a tool, and it's not made for healthcare professionals. This is for you. So have this if you're a coach, a referee, a parent, so that in high stress, it's good to have something like this to go through. Okay, it's a concussion recognition tool, and it's the most updated one. So if you do suspect a concussion, you got to get them to a healthcare professional. Now, every state has a law about who that healthcare professional should be. In general, what I say is if you can get to your primary care physician, your pediatrician, your internal medicine doctor, that's really the best initially because they know you the best. And let's be honest, not everybody has to come see a sports medicine specialist like myself, but if you're struggling or your primary care doctor's like, I'm not really sure how to get you back to parkour or rock climbing, or I was watching something today on like windsurfing. Like if you don't know how to do that, that's okay. Get them to people that do. Do not, especially in this district and even in St. Vrain, don't stay home and from school until all your symptoms are gone. Concussion significantly changed starting in like 2009, 2013, when we started to realize that when we were keeping these kids and doing this dark therapy, we were actually creating secondary pathology of anxiety and depression. So in this district, especially, we have return to learn. So there's going to be a couple days where people need to stay home because they just feel terrible. Like I'll walk into the door and I'm like, oh, that kid's going to be down for a couple of days. That's okay, but don't have them stay because you need to find out what the school policy is. You'll find it's actually really encouraging here in Boulder Valley School District. If your school is a charter school or if it doesn't have a concussion policy, Boulder Valley School District, we've always made our policies available for folks to use. But I have always found, at least in our area, anytime I go out to a school to help, schools are always like, teach me about how I can help these students do better. So this one's really important. And there's a reason. Key points, the ER and the urgent care is not the place that you go for definitive management of concussion. I can't emphasize that enough. We collectively in our district will see people that go to the ER, they get a diagnosis of post-concussion syndrome when they just have a concussion. We can talk about that later. And they get their gradual return to play in the same appointment, and they let the family's management. That's not the way to do things. You're going to the ER to make sure you don't die, to make sure that you don't have that skull fracture, you don't have that brain bleed. Ultimately, this diagnosis is managed as an outpatient with someone that either knows you or a specialist that is used to doing this. So please remember that. A lot of times people will go back to the urgent care or the ER because they don't know how to get their kids' papers signed to get them back. That's also not the place to do that. The ER and urgent care is not where definitive management needs to happen, okay? This is important too, again, for you, especially if you're a club team and you're trying to figure out, should you spend the extra money to hire an athletic trainer? Yes. That's another topic of discussion. We have this is a SCAT, and the SCAT is also updated with every time we have one of these international consensus statements, and it's a tool that we use on the sideline. Athletic trainers are the masters at this, and it's how we assess on the sideline. And everyone uses this. So all over the world, this is standard, okay? And this is what it looks like. We have a kid one and we have an adult one. So that's really important. That's what it looks like. So again, this is for healthcare professionals, but you may, if you're all those big soccer tournaments that happen out in the soccer fields up in North Boulder, you're gonna have an athletic trainer there, and it may not be an athletic trainer that you know, but they're probably gonna hand you maybe that SCAT form to take to your doctor. So that's a real, just where you might see it, but this is pretty standard. So when do you worry about concussion? So I mentioned loss of consciousness. I just want to make sure that you know I'm not saying that loss of consciousness isn't important. A transient loss of consciousness versus the longer you're out, the longer, first of all, I'm going to be out there if you've lost consciousness. But if you're out on the field with us, athletic trainers out there, I'm out there, and we're watching that loss of consciousness 1 minute, 5 minutes. Your differential diagnosis, which means what I'm thinking in my head, gets bigger and bigger. So usually concussion is not going to cause something like that. It's going to be something more severe. So that's going to get transported. That's something you have to worry about. Distracting injuries, this is essential. I can't tell you how many times we see this. Let's talk about bikes, right? So you have a bike crash, break your helmet, suspect concussion, it's Boulder, so you fracture your clavicle, you got to go get that fixed, and you dislocate your finger. Those other musculoskeletal injuries are what we call distracting injuries, and now you're not a reliable patient to me with your head injury or potential neck injury. So distracting injuries can make it really complicated to manage that head injury. Repetitive vomiting that won't stop, that's important. Worst headache of your life. Parents, if that happens, you're taking your kid to the ER, you don't want to manage that at night. They might just say it's concussion, that's fine, but you don't want to have to make that choice. If they're unresponsive, or if you're watching them, like sometimes if we're not sure on the sideline, you might, if you want to know what we're doing, we might take a kid's helmet and then just watch them. And you're watching how they evolve. And if all of a sudden we look over, or the student that with them comes running over and say they just passed out, that's a rapid decline in their consciousness and difficult to arouse. So if you haven't seen what a concussion looks like, this is my wonderful now friend, as well, one of my previous athletes, Ashley Kane and Tim DeLuc. And this is at the World Championships in France several years ago. And this is what a concussion looks like. So you can see Ashley's a pair skater, so it's the riskiest thing that we do other than synchronized skating. And what you'll see coming up here, this is a fall that she has, and she bangs her head on the ice. Very uncomfortable to watch. Watch her face right here. Now that's her mom, actually, who's her coach. And what you'll see right here, and it's still kind of like COVID, so some people have masks on, but watch Ashley's face right here. So she's gonna hit the ice. And then what's great about this is how also Tim responds. So he doesn't get her up necessarily. He looks at her first. See that posture? No good, right? She kind of was aroused. She's floppy. Is she loss of consciousness or not? She starts to get herself up. He does not pick up her neck. Pretty soon they're going to zoom in on her face here, and you'll see that. That's a concussion. Completely disoriented. And I love what he did there because he learned how to take care of her. That's Dr. Workman, and my favorite French doctor, going out and picking her up and getting her off the ice. No neck injury there, but that video, although it makes you uncomfortable, is a really good video if you've never seen what concussion looks like. So what's the best practice? So sideline assessment right away. Yes, here's my plug for athletic trainers. If we want to do one thing for kids across this state and across the nation, mandatory athletic trainers at high-risk sports, football, even middle school, having someone there because they're trained. If you don't have the luxury of an athletic trainer or someone that is a sports medicine provider, getting them out, asking those sport-specific questions, and then just erring on that side of caution. But in general, I would say things are better if you're afraid. And I always think about coaches, parents, and referees in this talk because it's hard to make those decisions. It's hard for me. You don't want to take a kid out, but sometimes you have to. You're thinking of the best interests of those kids. Brain rest. What do we do with this? So this is still a thing. It's just not as big as it used to be. And so, yes, there's going to be times where you're going to have to stay away from screens. Like, all that stuff is still true. But remember what I said at the top of the lecture. It's individualized for everyone. So you may have a time frame where you can't go outside for a walk. You can't look at screens. You can't be around bright lights. That's okay. But remember, it's going to be individualized. And if you're a student, whether you're a graduate student or an elementary school student, there's return to learn and there's return to play. So return to learn is really unique, and this is a really, really important section of this talk that I want you guys to have. So we're so fortunate. We have such a wonderful community here in Boulder and what we've been able to do with concussion. So return to learn is a thing within our new concussion guideline. It was the first time it was actually mentioned. So this is the only part where that guideline doesn't apply to you if you live in this county, because we've been doing return to learn for over 10 years. So we have a lot of things that we know how to do, but this was a big success point for our international consensus statement. So please don't try to manage this on your own. Again, if your school doesn't have a concussion policy, policy, talk to them about it. But if you're in Boulder Valley School District or even in St. Vrain, there are concussion policies, even in Jeffco and things like that. So if your kid is not on concussion protocol or they're coming home from school and they're exhausted, there are academic adjustments that we put in place for a reason. We're going to put that up in just a second. What are other things that we do? We do treatment with exercise. So good old Dr. Letty that you'll see later in the talk years ago realized this brain rest thing probably wasn't working out so great for us. So what we do now is we do a little bit of exercise. We get these patients, like not in a contact way, in a safe way, a walk, a stationary bike, something like that. So you're going to treat each concussion differently. Some kids can go on the computer and start learning and start doing some things like within the first week, and some people can't. So you're going to see it individualized. And so one of the things that's really important is some of these symptoms may get exacerbated as you try to do things. It's okay. It's okay as long as it's just a little bit of an exacerbation. If it gives you symptoms that are like out of 10, maybe gets you to like 1, 2, or 3, 4, that's okay. But if it really puts you back, I described the concussion roller coaster. You do not want to ride a concussion roller coaster that looks like that. If you have little bumps on your rehab and getting better, that's okay. We also know a lot more about how important sleep is. Gone are the days where you wake people up. If they have a concussion, let them sleep. Their brain needs to recover and they need to heal. So there's, again, so much that we can do. So this is important, and this is just what is so wonderful that we get to do this talk for you guys, because this district in this area that we live in, we're just so blessed. So we have this return to learn versus return to play. And return to learn here is probably one of the neatest things that we have been able to do collectively as in this area. So we have this partnership that has lasted for decades now, where we work very, very closely with Boulder Valley School District. We have a team called the Brain Injury Resource Team, and it is a team that wrote and put into policy our Boulder Valley School District concussion policy for not just varsity athletes. Varsity athletes will always have concussion protocol, but this is for all kids in all of Boulder Valley School District. So kindergarten all the way up to the musical theater person that's inuring themselves doing set design. There is this policy and these things that we can do. So you may not know this, each high school in Boulder Valley School District has a team physician assigned to it, and you can see them listed here. And then they also have an athletic trainer that we collectively work with. So that's for varsity athletics. So this is one of those really big slides if you're looking for a slide not to just keep on file. This is where we learned about translating medicine into education. So I'm married to a previous elementary school teacher, really helpful to understand his language and how do I help a teacher to learn how to differentiate, that's a school word, to the student. And so what you do is you clump those symptoms. So if they have headache and nausea and vision changes, those are somatic symptoms that are manifesting in their body, so the teachers can learn how to make differentiation to the students to help them to learn. This is a really good graphic here. These are some terminologies that you should be aware of when you start to work with the schools. I had to learn all this. I had to learn how to speak their language. We talk about academic adjustments, not necessarily modifications, but academic adjustments. Differentiation, all teachers know what that means. If you're teaching up on the hill on campus and by where our office is, they know that word. If you're teaching kindergartners, you know that word. So helping teachers in our district to learn how to differentiate to the student is essential. 504s, really important, and then IEPs. Usually for concussion, we end up doing a 504. An IEP usually translates more into special education, but these are words as parents that you should be aware of if your kid is struggling. You need to go ask them this. This is another resource for you. We may be modifying this over the next year, but this is another resource that we use. It's called a concussion. It's a tool that we use to have the kids. It's a feedback form that we send it with the kids if they're struggling, so they can take it and have an individual conversation with each one of their teachers. We can tell them that there's this concussion policy, but they've got to talk to their teacher. I could be the best doctor in the world, but I'm not at school with them. The students have to talk to their teachers to be able to know what kinds of things do they need for each class. This is another really and super important slide. These are all and not even everything, but all of the academic options or availability things that you can use when your kid is concussed. In Boulder Valley School District, once your kid is concussed, you should be getting an email that says your child was concussed or on concussion protocol, and we just decided several years ago just to send this out. Teacher's gonna get a copy of it, and you'll get a copy of it too. So when your kid's coming home and they're hosed from a day at school, you can say, hey, did you take any of these academic adjustments? And if they didn't, which kids don't want to, they try to push through and then they tank, then you can have some basis, but this is how we differentiate to help them navigate their concussion. So again, translating more medicine into education, how do we make these grouped kind of symptoms together? How would we translate them into treatment? So this graphic is showing you that if you have headache, let's say, and vision changes, you're gonna maybe need physical therapy or vision therapy. So we have to sort of really make a cocktail, if you will, of how to treat each concussion because they're all different. And so one kid may need to do vision therapy where someone else may not. Our physical therapists are trained with vision therapy, but if they need prisms and their glasses, I may have to send them to someone who does neurooptometry. So this is another one where when teachers are saying, hey, this kid isn't doing so great, maybe you need to go get extra treatment, these are also things that can be combined into a 504 as well. So there's already so much that we can do. And I think this is another reason why I love this diagnosis so much, because it's not about me. It's about the team. I don't get any concussion kid better without you as the parent, without the athlete, without the teacher, without the coach, without the counselor. It's a team. We have a medical team and we have a school team. I love my job, and that's because I don't get anybody better with anything that I do by myself. It's all about the team, and I love working in a team environment. But that's what your team could look like. Not everybody, but some people. One question we get pretty frequently is, how do you know if one concussion is going to be worse than one other one? This is a really lovely list of all of the different modifiers, things that could stratify and potentially put you at higher risk for a concussion that's going to be harder to manage or last longer. Again, another slide for you to look over, but how many days have you been symptomatic? How severe are the symptoms? How many things happened to you after you were concussed? Were you seizing? What kinds of things happen? What's the timing? How close together? When was your last concussion in comparison to this new one? The threshold concept is true. Once you've had one concussion, you're more likely to have another concussion. So all these kinds of things are really important to know. And these are things that we learn when we get to see you quickly so we can risk stratify. So what are helpful hints? Because this is clearly super confusing and a lot of information. So remember, athletes themselves, they may not recognize their previous concussions. They may talk about a ding, and they may have the story that as you talk to them and listen, you can hear when they lost it. I used to love to read in 7th grade. I got that concussion in 8th grade, and now he or she's not really a good reader, right? That's really important. They might not identify and put things together until you unpack it with them. So miss previous concussions, get that concussion history. I always tell students, right? Like the mysteries in the history, baby. That's how we say, right? 85% still, no matter how much AI we have, whatever technology, you gotta listen to people and you gotta let them tell their story, because then you can find out what happened in that previous concussion. Coaches, teammates may not recognize it, but they can also be super helpful too and tell you some information that why Johnny was over there, he was stirring up, but then he came to you and said he was fine. So that can be really helpful. Asking a history about previous neck and face injuries, because those or head injuries, fractures, because those could have had concussions with them too. And even though concussion has changed so much, athletes still are going to underreport symptoms. No matter how cool we try to be in sports medicine, there's still fear around this diagnosis. There's fear of removal from the game and their sport. So we want to keep helping them to understand that. So return to play has changed so much from when we first started, and you can actually now start that gradual return to play within 24 hours. You could get them on a bike. That's fine. Maybe they can only go 10, 15 minutes, but they're moving. How many parents, if you were all here, I'd have you raise your hands, how many parents are going out of their mind because their kid's bored? They're trying to get better from their concussion. They say, please, can I exercise? And it used to be like, no, you can't. Well, now you can. And there's some caveats about that. If you look on our gradual return to play form, you'll see a hard line fine for us. We talk about step 4. And step 4 is now, with the most updated international consensus statement, is when you're at risk for another head injury. So you're on the sideline doing sport-specific soccer stuff and a fly ball comes, you have to get official clearance from a healthcare provider to get to there. So you could have your kid, let's say it's a Monarch kid, who has a concussion, soccer, let's pick on a different sport, and the athletic trainer has started them on their gradual return to play, and you're like, oh, they're exercising? Teachers, if you're watching, this is okay. They're still on concussion protocol, but we're doing exercise to help them get better. But we're not letting them in a place where they could get hit again, which is where you need to come see the doctor again. Interestingly enough, this is a fun little fact in the most recent international consensus statement. They said kind of mean time from front to end on a concussion, like the initial concussion getting diagnosed, and then total return unrestricted play, 30 days, right? Before COVID, we looked at Infinite Campus, so that's where we kind of log all of our concussions for the district. We did just a real small study, and we looked, how long are kids in Boulder Valley School District on concussion protocol? And guess what? 28 to 30 days. And that was even before this study came out, which is pretty cool. So everything's still individual basis, but it is a 2-step process. You got to get that diagnosis first, get them better, get them symptom free. And then unfortunately, you have to go back to the doctor at least twice to get that clearance to go back to full sport. These links in through here, you can click on them. The second one is your link. If you type in BVSD concussion policy, on the right-hand side of the screen is where you'll see the concussion forms. And the concussion form is standardized and it's updated and up to date with the most recent international consensus guideline. There's a place for an athletic trainer to write what happened. So if an athletic trainer, someone sees it, they bring that to the doctor's office. The first step is that, does this kid have a concussion or not? And if you're like Cherry Creek or if you're another district, totally use these forms. Totally fine, it doesn't bother us at all. And then the next section is return to play. So this is a good one for you to have access to, and that first link is that journal article that I told you guys about. So what do you do if you have persistent symptoms past those 30 days? And if that's the case and you've been managed by your primary care doctor, that's when your primary care doctor may say, I think you better go up to sports medicine, or you better go see someone that knows how to handle this. So that's a really good rule of thumb. Again, in the most recent international consensus guideline, this was for all ages. We used to talk about this more for kids, but this is for all ages. So if you're symptomatic still with a concussion after 30 days, you need to see someone that's experienced in the management of concussion. You probably need to be in physical therapy at least, and we need to be doing more for you. So this is important, and this can happen because of pre-existing issues, like I showed you on that last slide, all kinds of different things, but that's really important. In other words, please don't sit and think this thing is gonna get better on its own. If it does, great, but it's not gonna get better on its own once you're past that 30 days. You probably are gonna need more help. Please don't do that. There's things we can do for you. So rehab, I'll tell you a little bit about this at the end too, because since we've been doing this for a couple of years, we get the feedback that you guys would like a lecture on just what rehab looks like. And this talk tonight is to give you the overview, and then we can fill in other places of what you're interested in. So rehab is really important. So if you have dizziness and neck pain or headache that's still persisting even after 10 days, you probably are gonna need some physical therapy or something to help you with that. So you're gonna wanna recommend physical therapy if they're struggling with that. Again, if it's beyond the 4 weeks, you got to make sure that you're paying attention to that. And if kids are getting a lot of symptoms when they're having return to learn, you're going to have to look at more treatment for them as well. So again, these are whole lectures. Of course, we do whole conferences on just concussion, going through each section like one at a time. But what does physical therapy do? A ton. And we're very blessed at the Sports Medicine Center to have this amazing concussion team where everybody has their own specialization. Yes, you're working on the neck, you're working on the musculoskeletal system, you're working on their eyes, you're working on your vestibular system, which is way in here, incredibly comprehensive. And then now you're working on even learning how to put all of those together, which is super fun, and making it sport specific for you. There's Dr. Letty that I mentioned before with a patient on a treadmill, and a girl too, that's important. And so we incorporate exertional testing. If you know anything about concussion, you've heard about the Buffalo protocol, that's where it started, right there on a treadmill with Dr. Letty. So we look at getting heart rate up, giving people a threshold of heart rate, 85% of this, or do this heart rate to exercise as you're getting better. So we look at that. That's a large part of what we do from a concussion therapy standpoint. And then slowly over time, we're going to give you more and more exertion to do. And then when you get to the really high levels, we're making it sport specific. This is a really fun picture, especially for me. At the bottom picture, you can see the flume. We have a huge blessing, again, at the Sports Medicine Center to have a flume, which is a pool, and we can set a current against you. We have done amazing things. So for those of you, right, we live in Colorado, there's those things right out there called mountains. And so we don't just do sports in Colorado, right? We don't just ski, right? We go to the terrain park, we freestyle ski, we have a half pipe, we do parkour, we do mountain biking, we do my equestrian stuff as well. We do all kinds of like rock climbing. So we do high risk sports here. So how do you get some of these sports back when they're really afraid? A parkour athlete, a flyer in cheerleading, we put them in a pool. When you rotate and spin and twist and turn from an early age, or you go as fast, like our equestrians going 34, 40 miles an hour, ice hockey players going super fast, all of our bikers, we have found the flume and water to be an incredible resource for us. I have to say a blip about this. Again, you could do tons of lectures on this, but I'm really persnickety about this. So again, I mentioned this, you don't leave the ER with post-concussion syndrome. This term has incredible stigma. It makes you feel like you're never gonna get better. We typically talk about post-concussive syndrome when you've had symptoms lasting more than 3 to 4 months, right? So understand, even if you have been diagnosed with post-concussion syndrome, there's still stuff we can do to get you better. All it means is that somewhere along the lines in your concussion treatment, something got lost and you got delayed. So you're not recovering as quickly as normal. There's stuff we can do for that. And it's multimodal again. So I have to talk about that because that's really important. So again, you don't leave the ER or the urgent care with that. You leave with concussion, acute concussion. And acute concussion is different than post-concussion syndrome. I'm like nuts about that, you can tell. So, but then remember, even though all of this hullabaloo about concussion, most concussion is gonna get better on its own, which is super amazing. So it is possible to get a concussion 1 week and be back to your activity in a week or two. That is possible. It's just when things get more prolonged that it gets tricky. This word you do need to know. We don't talk about it as much as we used to, but this is why there are concussion laws in every state in this country. So second, for us, it's Jake Stankenberg that is our law here in Colorado. And this is the concept that if you get hit and get a concussion and you are not removed from play and you go back in and you get another hit, it's total and sudden collapse of your autonomic nervous system, and it can lead to death. Not in every state kind of has their story. And of course, it's the beginning of school and sports have come back and you're already seeing in the headlines like this sporting injury happened, this one happened. But if you are a referee, a coach, or a parent, and someone is yelling at you saying, I want to sign, I'm not going to seek medical treatment, you say, no, I'm sorry. It's a law. It's a state law. And because of this thing called second impact syndrome, I'm going to sit this person out. So we don't have a lot of data on it, but it's important. And obviously sports are supposed to be fun and something we do our whole life, not something that causes us lifelong impairment. This is really cool. I'm so excited about this. So with our new data, we are in the very end stages of revamping our baseline testing. Baseline testing is, again, a whole nother talk in and of itself, but we've taken baseline testing and we've learned a lot about it. We hoped a long time ago, 10, 15 years ago, that the computer-based testing was going to turn into something. We really don't use that as much anymore. It's a tool. It's just a part of what we do. Our office is getting ready to revamp and have redone our concussion baseline testing to take that international consensus guideline and incorporate new things. Remember I told you we're going to come back to neuromuscular testing? So here's an awesome study. We can thank Children's Hospital for this. We know that there is a study that talks about within the first 6 months after you've had concussion, you are at increased risk, not just for another concussion, but for another injury. So let's say your kid, let's talk about girls, because I just was looking at something today that looked at numbers of ACL injuries going up over the last decade. So let's say you're a female soccer player that's the most likely to get a concussion and not be diagnosed. She comes back from her concussion and she's doing great. She's so happy to be on the field, right? She can play year-round soccer. She's playing with Albion. It's super exciting. And then all of a sudden she plants, twists, tears her ACL. Within the first 6 months, now she's got a 12 to 18 month injury that she's got to deal with. So what we're looking at now is that neuromuscular training that we referenced in the beginning of the lecture after we have concussion and we look at baseline testing, there could be some things that we're missing in how we move. There's more and more evidence about dual tasking and looking at how we clear someone to get back to play. So we're really excited with what we're going to be able to do with our baseline concussion testing, and that will be coming back for us. And that's a constant work of art that is changing, always changing based on it, but it can be a really important tool, especially if you know if someone has convergence issues with their eyes, and let's say they don't know it, and one eye when you go like this comes in, but the other one floats out. If I know that that's what your eye exam looks like before I see you, because I have a baseline, I'm not going to freak out, right? Or I'm going to know, hey, your concussion might take a little longer because your eyes aren't working as quickly or as nicely as they should. So baseline testing does have some merit. So where do we go from here? Again, one of the things I would just like to highlight, it is totally been my honor over the last decade plus to be able to sit amongst all of these wonderful organizations that you see here, whether it's all the wonderful gifted people in my office and all the educators and all the counselors and administrators in BVSD, and then our trauma team here at BCH. All of us work together to create all of these great programs and to get your kids and get people in this area seen quickly. And so we're really excited about that. One of the things that came out as of a result of our most recent international consensus statement are all of these things that you see listed here under Refine. And one thing I really want to highlight here, because we do see all kinds of athletes at the Sports Medicine Center, this was the first paper that ever talked about our para-athletes. We see all different kinds of para-athletes, and the fact that we are having a discussion about how do you do a balance test in a wheelchair athlete. So my wonderful friend, who is our team physician for Team USA for sled hockey, is like, oh, we have to figure out balance testing in a wheelchair. How do I do that? So this is a really huge step in the right direction that we're starting to talk about all athletes, including our para-athletes, which is really exciting. So stay tuned for that. Other things that we have learned, kids graduate. Teachers change jobs. So our group at our brain injury resource team, we always have work to do. Constant education, continuing to bring you programs like this is really important because concussion changes, and it's important for us to continue this education. If we can help a family or a person to avoid a complicated concussion, it's a huge win for us. So we have to have kids and teachers talk. I'll never forget my student athlete Boulder High School years ago. He said, Dr. B, listen, I love the fact that there's this concussion policy, but the work is up here and I'm down here, and this is freaking me out. And it really showed us that we have to help kids talk to teachers. We need to break down walls and do things in our schools to help those kids get the support that they need so that they don't feel like they're failing and they're drowning in school. That's important. Coaches need education too. For all of you that are coaches in the district, you have to listen to me every year, right, in your compliance talks that we tape for you to watch. But we need to continue coach education. That's really important, and it's got to be interesting. It can't be bland. It has to be applicable. And speaking the same language, I have learned so much from my educators over the last decade plus and learning how to help them, what fears they have. I remember years ago when I first came home and I was so excited to tell my husband, the elementary school teacher, about, hey, we got this great policy. It's going to make this great big difference. He didn't even teach in this district. And he said the same two things that our teacher said when we first introduced this. He said, I don't want to hurt a kid, and I'm afraid kids will try to play me, try to fake it. And it was so fascinating. It's like, he doesn't even know these teachers that were afraid of this. So we have to keep talking about the fact kids hate this diagnosis. Kids don't want to look different. They don't want to be out of school. They don't want to wear sunglasses. They don't want to be not able to do fun things. So it's extremely rare for kids to fake this diagnosis. I can't even remember the last one that I had that was faking. I can't. That's how infrequently it happens. And then in addition, when you make concussion worse, you make symptoms worse. So are you going to give them a headache? Yeah. Are they going to throw up, get a migraine? Yeah. But in general, if we're teaching teachers and school districts and coaches how to differentiate and help that kid, the likelihood of you making a concussion kid really, really worse is, if you're trying something, is low. And if you do make them worse, you can recover from it usually. But by not talking about it and not teaching and speaking the same language and just avoiding it and thinking it's going to get better, then we're going to be in trouble. This one's big for us because we've learned so much. Concussion doesn't matter until it matters. So for many of you, you might be watching because you yourself have had a concussion, you're around people that have had concussion. It's tough to try to figure out how to educate people can be really hard because people don't necessarily think about this until it becomes personal, right? So it matters. And so continuing this education is really important. And like I said at the top of the hour, once you've seen one concussion, you've seen one concussion. They are all different. And that is so important. It can be a huge part in helping to partner with mental health issues as you navigate concussion to help people to understand that each concussion is different. One concussion may take you a week to get better from, but another one could take months or a year. And then this one's really exciting for me personally. Concussion programs work. In my wildest dreams coming from Northwestern, I never would have thought that we would have ended up with a multidisciplinary concussion program in a district that we could make a difference with, but they work. But it takes a lot of work. I mean, it takes no ego, and we all come together. Everybody's got an equal seat at the table, and all of our ideas are important. Because I learned from my administrators, I learned from my coaches, I learned from my parents. So concussion programs do work. And with that, I'll give you one of my new favorite quotes, because sometimes concussion can feel impossible, but I think it's kind of fun to do the impossible, just like Walt Disney said. So I do always put this up at the end. I could not, I'm just a face, I'm just the vehicle. This work that we do in this county is not me, it's everyone. And this is just a small spectrum of all the people that have contributed. And I could not do this work without all of the people that are on this slide and even more. So I can't thank you enough. And I do want to say what's next. We did listen to, if you are a repeat watcher, last year you wanted to hear more about concussion rehab specifically. So what we decided at the Sports Medicine Center is we will be filming a really cool concussion rehab treatment lecture. I'll be the monitor, and we're going to take our physical therapists, the actual people that get you better. I'm going to do a panel. We're going to ask them questions. So that'll be up on our blog. I don't have it ready yet, but keep watching. We have a blog section, and that's where we'll post that, because we definitely got feedback about wanting to hear more about that. So hopefully I've done okay with time, and I am ready for questions.
All right. You are always so full of information. We just appreciate all that you've shared with us tonight. We do have a few questions, and we want to remind our audience that now is the time for them to ask any questions in the chat box below the video on our screen, and we'll get to as many as we can.
Great.
And they're in no particular order. So, is it safe to give someone with a concussion medication like Tylenol or Motrin?
Thank you so much for asking that question. You know, concussion has changed so much. That used to be something we always talked about. And yes, the answer is yes, now it is. When we were still in the brain rest era, you would hear this idea that you shouldn't give them those medications because it could mask their symptoms. It's okay to give them that. What I'll tell families in the office is if you're finding that the person is living on those medications, you need to tell us about it, because then you're going to have consequences. But yes, in that acute phase, if you're watching that person and you're with that person, you can give them Tylenol or ibuprofen. That's okay to do.
Okay.
Good question. Thank you for bringing that up. I'll add that next year.
So do you know if someone is wants to see you, do they need a referral from their primary care?
It's a great question. So we have a lot of things set up at the Sports Medicine Center to make sure that you're a right fit for us. So it's really good to have a referral from your primary care physician. It also depends on your insurance as well. You don't specifically need one though. So if you don't have a primary care physician or you are struggling on your own, you can come directly to see myself or any member of my team. I will tell you, I have 4 other primary care sports medicine doctors. Those team physicians, with the exception of Dr. Eric McCarty, all those folks that are at your high schools can see concussion too. And we have that huge concussion PT team as well. In fact, you can even, your primary care doctor can even refer directly to our PT department too, just for concussion. So that's a great question too.
Okay. Is a person who has had COVID more susceptible or prone to concussion after they've had it?
Again, excellent question. So our wonderful friend Karen McAvoy during COVID, who is an educational psychologist here in the state of Colorado that has worked with us in BVSD and in school districts all across our state, made a Venn diagram that looked at concussion symptoms and COVID symptoms. And then of course it's a Venn diagram, so it's the place where they overlap. COVID, long hauler syndrome from COVID, you can have a lot of symptoms that look the same. So we absolutely post-COVID and these post-COVID years, we are seeing patients that are down at National Jewish at the long hauler, the COVID, long COVID clinic that have had concussion as well. So this gets really tricky, and I really want to validate you if that is you. You can absolutely, it can be more difficult. I would put, if you have had complicated COVID, I would put that now as a risk factor if you did get concussion, that slide that I had all the modifying factors. If you have had COVID and you are not all the way better and you're struggling with long hauler or constant effects from COVID, that I would consider that a risk factor for a potentially more complicated concussion. It's an excellent question. It'll be really interesting to see how that research evolves over time.
Remind me, what do you recommend for non-sport head injuries, like a car accident? What kind of doctor do you go?
That's excellent. Again, I can't say enough about our trauma team here at BCH and our collective team here across Boulder. So we are really working collectively together to help you to get that. So if you call our office and you have had your motor vehicle accident concussion, or you are a military person within the university, because I'm a professor, I'm in the Department of Orthopedics, but we have a previous NFL clinic as well as a military concussion down at the university at Anschutz, so that's a really special clinic that you can go to. We have neurologists here. Dr. Young is one of our new neurologists here at BCH, and our trauma team here at BCH will also see some of those concussions that come in as well. So if you are not an appropriate patient for a sports medicine physician and you're struggling with, and your primary care physician's not sure what to do, that's a really great place for a neurologist to come in. Can be.
Okay. This person said they're seeing mixed opinions on if mouth guards actually do prevent concussions. Is this something that the jury is still out on?
As you could see from the research that they collected, it was in the 23, 28% for, and that was specific for ice hockey. So what I'm going to tell you, please wear mouth guards, and I'm going to tell you another reason why. So it may not necessarily 100%, and we may not know in each sport if it's preventing against a concussion, but this I'm going to tell you. I never realized before in the past how important this little joint is right here. This is called the TMJ. When I was in medical school, I thought, oh my gosh, I'm in neuroanatomy. This is another joint I got to learn. I'm going to be a sports medicine doctor. If you have facial trauma or you have jaw issues, which a mouth guard in sport can help to prevent you from getting a worse injury, this can be a huge generator of post-concussive headache. And it's so big that we have seen a whole cohort of our patients that are sport-related concussion patients who end up with post-concussive headache and migraine just due to this. So please wear your mouth guard, not necessarily just to protect your teeth and things like that, but to prevent the potential consequence of things that could happen in that trauma. It's an excellent question. And I think we're going to continue to see that research as we're seeing more specific sports.
Okay. I think we're going to squeeze in a couple more questions and wrap it up.
Great.
What is the proper procedure to move a concussed or injured athlete from the field without making the original injury worse?
Wonderful. You should have been with us a couple weeks when we were practicing our emergency preparedness. So every year we go through this, our emergency sideline preparedness. This can be challenging depending on the venue that you're at. So we recently, over the summer, we're lucky enough to talk about equestrian sports medicine. This applies to mountain biking. You can be in challenging environments, making your evac of your patient pretty difficult. The number one thing you have to be mindful of if you have a head injury is this person is not a reliable person. No offense to them, but they are concussed. They're not normal in their brain. You have to screen the neck. You have to screen what we call the C-spine. So if you suspect that at the same time that they got a head injury, concussion, skull fracture, facial fracture, whatever it is, you've got to look at the neck. And if that patient is loopy and you can't ask them if they've got neck pain, leave them and wait for the professionals to do. If they have neck pain, and you don't necessarily have to be entirely trained, but if you can screen them and say, does your neck hurt, or even touch things, like, I would say leave them. Because if you have head injury and neck injury at the same time, please don't touch that patient, because you could make something that is potentially easy to fix become a big problem. So it's tricky, but understand that moving them, getting them to a safe environment, especially if you're outside, is really important. Protecting them from other people around, like bike races, are important. But if there's neck injury, call 911, and that's really, really important. I would highlight that because in that video that I showed you with Ashley, Tim had learned at that point in time, when she had previous injuries, he had come up, and we've seen them take people up by their neck. Don't touch their neck. That's a bad idea.
And just to kind of be a little clearer on who you see, this person had some questions. If you just have had a concussion, or you think you have, you do go to the ER, but afterwards you go to your primary care or a trauma team or neurologist. Can you please clarify?
Yeah, let's go through kind of like an algorithm. So let's say you're not really sure and you're at an away game, or you're someplace, or even you slip on ice and you're the parent watching the kid at the hockey game and there was ice and you fall. If you are comfortable and if your symptoms are not significant enough, you don't always have to go to the ER and the urgent care. If you're not sure and you feel really uncomfortable with what that patient looks like, it's totally okay for you to take them to the ER and the urgent care. Have the expectation that they're going to help you make sure you're making a safe decision. Yes, this person has a concussion, but the ER and the urgent care will always tell you to follow up within a week with your primary care physician. Again, completely appropriate. If you don't feel like you need to go to the urgent care or the ER, 100% go to your primary care physician. And if your primary care physician is not comfortable with your management, they're going to tell you. And then depending on what kind of concussion you have, they may say, oh, go to the sports medicine center. They can help you out. Or they may say, if it's a motor vehicle accident, go see this neurologist. So there's lots of different ways. No one way is right, but please be seen. Please be seen by someone. And again, it doesn't always have to be the urgent care or the ER. But the one thing that is, please don't go to the urgent care or the ER for return to play. At least go see your primary care physician. And I'm sorry, parents, but that's the way it's got to be. It's not going to be, concussion is not going to be one. It's never going to be one doctor's appointment unless you don't have one. You say, no, you don't have a concussion. You broke your nose. That would be the one-time thing, maybe.
That helped clear up the
hope so. Yeah, that's
a whole
good.
lot. Thank you for that. We've gone over a little bit, but we have come to the end of our time. A recording of tonight's lecture is available at bch.org/livestream. You will receive a post-lecture survey by email. Please take a minute to fill this out. Thank you for joining us, and have a good night.